Hi everyone, welcome back to another episode of the Sliding Scale podcast. Today I have another special guest with us. This is Dr. Manish, and he's a critical care physician in training, which means he takes care of people in all the worst phases of all the diseases. And he sees morbidity and mortality at a scale that's difficult for even some specialities of medicine to imagine. And being able to operate with calmness and poise when you're surrounded by human chaos takes a lifetime of training. And that was the reason that I invited Dr. Manish to talk about critical care and also content creation. So he's basically an emergency physician who's now gone into critical care. So welcome, Dr. Manish, to the show.
Yeah, hi, Naren. Thank you for inviting me. Just give me a second. It's my yeah,
Yeah,
good.
sure, no problem.
Yeah. So, thank you for inviting me. Happy to be here. Happy to be talking. So, how are you?
I'm great. I'm great. So let's get right into it. Tell us a little bit about yourself.
So, as you already introduced me, I am Dr. Manish Taneja, and I am a super specialty doctorate of National Board in critical care medicine resident, second year resident, and I am by training an emergency physician now, getting trained to become a critical care physician, and you know me by my Instagram handle, Resuscitate India. My YouTube handle is the same. Uh, so yeah, I I am I like teaching. I like playing video games. I like walking, going long walks. That's about it, I guess. There's not much to it.
No, I'm sure there's a lot more to it, but we'll get into it bit by bit. So, Dr. Manish, you have pursued emergency medicine, and now you're pursuing critical care. What made you pursue this field? Is it something that drew you to it from your MBBS days, or was it something that you found while you were doing residency over time?
Yeah. So my college was pretty small, pretty mediocre. It was a small district hospital, and we did not have a lot of good emergency and critical care back there. So when in internship, I did not even know the concept of emergency medicine. And when I wrote my first exam, my first AIMS PG, it wasn't INI back in those days. Uh, couldn't crack it, but got decent enough rank to be offered a junior residency there. It used to depend on the ranks and all that. And I got a job in the Department of Emergency Medicine. And my first day, I mean, the patients we used to refer in our college uh, as a JR, first day JR, I was sort of seeing those patients and handling those patients, and obviously under supervision and care, and it just blew me. I mean, I just felt amazing, and haven't looked back ever since. I've been in emergency medicine ever since. And now I wanted to learn more, continuum of care, because after a while in the emergency medicine we sort of hand over the patients. So after a while we don't take care of the patients. So I wanted to know about the continuum of care, what to do next. So yeah, critical care seemed like a natural step in the direction.
Yeah, I think emergency medicine is a very emerging field in India,
Yeah.
and even when I was doing my MD medicine residency, I think we used to, in the beginning, really kind of look down on emergency medicine as a field, just because we didn't really understand what was required to be an effective emergency medicine physician. And I think it's like a trial by fire for everyone. And I think by the time we got to our final year, we definitely had a lot more respect for the kind of work that emergency physicians do. And I think most of that is because there is just so little awareness of what it is that what's required out of emergency medicine physicians. So yeah, I mean, I'm glad that that you found your calling, and like you said, emergency medicine and critical care seem like juxtaposed to each other.
Mm.
So that leads me to our next question, which is, um,
Yeah, I'm sorry to cut in. I mean, uh,
no, no, go
emergency
for it.
medicine is pretty new in India, and it's
Yeah.
going to take a while for it to earn its respect. I worked in the department for a while, and uh, um, for not for a while, but for a long time, and I realized that not a lot of people really, uh, you know, respect us, and it sort of bugs you to some extent, but then you learn to deal with it, and slowly as they work along with you, over the period of months and years, they learn to, they recognize and they learn to sort of, respect you, and they learn to recognize your value. So yeah, I mean, I guess we will sort of reach there. It's going to take a while, but I think we will reach there.
Yeah, it's definitely going to take a while. I'll agree with you on that one. But so both of these fields, both emergency medicine and critical care, are fields where you have to be on your toes constantly. You're dealing with high adrenaline, high impact decisions, and that kind of work, does it predispose you to a lot of burnout? And if it does, how do you deal with it?
Yeah, I mean, it's it. The data is out there. I mean, emergency medicine is one of the worst fields to work in. I mean, as per the burnout rates in the US, we don't have the data in India, but as per the United States rates, it's that burnout rate is pretty high. It's really in the top four, top three at times. So it takes a lot out of you, because you sort of are at the worst. Your patients are having their worst days, and they sort of are at their worst behavior. Their family or their bystanders are at their worst behavior. So all that toxicity, and the toxicity of working in a department where you have to take those important decisions really well and really fast. You have to think on your feet. You have to be running around. It does take a lot out of you, and it does lead to burnout. But I've worked in the department from 2015 16 onwards till 2020 two recently. So it was a decent amount of time, and I learned to sort of cope up. I developed some mechanisms to cope up with that, and you sort of learn to cope up with it as you go along. Some people obviously don't, but most do, and most learn to enjoy their work. It's a really rewarding branch. It's really, you get that instant. You take that instantaneous decision, and if your decision is right, you really see the results immediately. You don't have to wait for the patient to go back home, take those medications, come back after 5 days, and you see that improvement. No, it just is immediate, and that sort of dopamine rush, it's really addictive. So yeah, uh, it's that.
Yeah, I think what you said about you know short-term gratification or instant gratification is something that definitely keeps emergency physicians going. I think for us in MD medicine, we have a
Yeah.
little bit of delay in seeing the impact of our decisions, but that's awesome. And I think it definitely takes a special caliber of human being to be able to deal with that kind of intensity and that kind of decision making day in and day out, and not everyone is cut out for it.
Yeah.
I think I think it's definitely something that people need to think long and hard about before they take a decision to pick up
And
emergency
critical care
medicine.
is
Or
exact. Sorry. And critical
yeah,
care is exact opposite. You wait and you wait and you wait. You
yeah,
just wait for your patients for months to show a little sign of improvement. So, sort of, have seen both of the ends of the spectrum. So I'm
mm,
enjoying it.
yeah. No, I think you made the jump in the right direction, I feel.
Yeah, I guess.
But as someone who's like a first line responder, you see the most amount of morbidity and mortality probably in the entire hospital. And so I'm sure that is your perspective on patients that die or patients with poor prognosis has changed over the years. And so how do you feel how do you feel your perspective has changed from when you were a student compared to now when you are a much more seasoned physician?
So, there are two ways of, uh, only two things can happen here. When you see that kind of death, either you get humbled by it or you get very cynical. It's best to stay at the middle of the spectrum. It's best to, sort of have both, you have sort of both the things in you. So I am a bit cynical and I am a bit more humble than I was when I started. You realize that uh, life is very you know unexpected and short, and things happen, and sometimes in an instant things change. So you get humbled by it, and you can also develop some sort of cynicism by it, because your faith might get dwindled, and you might question your faith, and you might question uh, the larger things, uh, the broader perspective, and what are we here for, and all those things. So yeah, I guess it's best to stay in the middle. Don't think too much, don't feel too much, as they say. Obviously you should feel for your patient, you should try your best to sort of give them the best care out there. But when with even with the best care, like let's say in severe sepsis with mods, even with best care, 50-60% of mortality is there. So I mean, that even with the best care, 50%, around 50% of them might not make it. So yeah, I mean, you have to have that sort of preparation, in your mental preparation, in yourself, that you can sort of deal with it. And if you can't, again, it may lead to burnout, and it may lead to you know hating yourself and questioning your decisions and your judgment and all that. I mean, it's part and parcel of working in the branch, I guess.
Yeah, I think that's such a fantastic way to think about it, is that either you get humbled or you
Mm.
become cynical, and that's a very, very thin and difficult line to walk. Um,
Yeah.
I mean, in medicine, I don't see that much. Of course, I see a fair share of death and mortality and morbidity, but I do see little normal basic diabetes hypertension patients, so it's kind of diluted for me. But even for me, sometimes the things that go wrong and seem so unexpected and just catch you off guard really do leave you feeling humble. And I have not gone to that cynical end of the spectrum yet, but I feel like if I stay in this field for a little bit longer, it's fast coming for me. Um, but I'd like to dig a little bit deeper into something that you said about how you were at one end of the spectrum with acute medicine as an emergency physician, and now you provide more of like maintenance care, waiting for something to happen in critical care medicine. But when you made that switch, did you have to change the way that you're thinking while you're approaching patients, or is it basically the same mindset that you carried across?
I get shouted a lot uh, at by my uh, by my head that you have to sort of prepare more, prepare better, and all that. In his words, emergency medicine is more reaction kind of field. You have to be reactive. You have to be on your feet, and you have to react to the situation or the patient which was presented to you, or which was filled in. But in critical care, you have to prepare. It's a more preparative kind of field, where you have to sort of prepare for the worst things and sort of avoid them before they happen. So you have to prepare and prepare and prepare, and I'm still learning. I mean, it takes a lot, and I still miss things. But yeah, I mean, but being an emergency physician, being trained in emergency medicine, I am quick. I think quick on my feet, and sometimes when things go south, or sometimes when the unexpected happens, I can think quick, and I can sometimes solve the problems better than my peers. But yeah, I guess uh, critical care is more about preparation, and emergency medicine is more about reaction. So I think, as I uh, sort of as more years pass in critical care, I'll probably be able to, tell that answer better or something like that. I'll probably give a better answer or
Yeah.
something.
No, I think this in and of itself is a great distinction to make, that yeah, emergency medicine is more reactive and spinal, and critical care is more anticipatory in terms of what you need to do for the patients and what might go wrong and how to prepare and how to deal with those things when they go wrong. I never thought about it that way. That's
Yeah.
yeah, I think it's a great way to think about it. Um, but so the other question that I wanted to ask you is that now there are, of course, a lot of students who are coming up who are interested in critical care, who are interested in emergency medicine, and you've seen a lot of doctors come and go, both seniors and juniors. But have you ever felt like there's a certain personality trait which makes people successful in this particular specialty?
Yeah, I mean, my friend used to say that no matter how smart you are or how good you are at medicine, even if you have everything on your tips, if you're not there at the right place in the right time for the patient, you don't really matter, right? So I have I've met people who were brilliant, who were brilliant physicians and who did everything best and all that, but they were lazy and they wouldn't get to the patient on time when the patient needed them the most and all that. So yeah, those people ultimately they don't do as well as the people who were there all the time, who were willing to sort of go the extra mile for the patient. So I guess that's one unique distinction. Also, you have to know to persevere. I mean, more than intelligence, I've seen people who persevered last longer in the field, and you need to have those skills to sort of deal with all the trauma and deal with all the stress. Because if you can't really do that, you are going to quit sooner than later. So these are some of the qualities which I think a physician who's willing to work in emergency medicine and critical care should need. Also, there should be a realistic expectation. People think that most of our work is doing the procedures, taking care of the really sick patients and all that, but no. As with every other specialty, our bread and butter is those mundane diseases, those diarrheas and acute gastroenteritis and upper respiratory tract and lower respiratory tract infections and all those things. Those mundane things are your bread and butter, but you do get to see a lot of sick patients compared to the other specialty, and a lot of adrenal rushes there. But yeah, I guess you need to be realistic about your expectations.
Yeah, I think that's the thing that most students struggle with, is that they come with this illusioned sense of what emergency medicine, what critical care is, and they always think that ICUs is a place where all this fancy stuff happens all the time. But रोज की रोटी तो भाई diabetes, hypertensive emergencies,
Yeah,
just the normal stuff.
yeah.
Um, so yeah, that's definitely a reality check for most students who come into these fields. But so you've been in this field for a long time. What do you think has been your biggest win so far?
Mm, I think it has made me a better human being. You know, I have become more humble. I was, sort of an angry person. I still am. I don't know if people know that, but I think people who have worked with me, they realize it. So it has made me more humble. It has sort of given me a reality check that your plans don't really work. Unexpected happens. So you sort of, mellow down, humble down, and and you realize that thus the swift nature of life, it just happens in a moment and you're gone. So just enjoy your time, enjoy your life, you know, have fun, and then you'll be gone. You're basically a candle. Sometimes you may burn, the whole length, and sometimes you just, may sort of vanquish midway or something like that.
Wow, that's a lot of philosophy, Dr. Manish. But no, I couldn't agree more. There's a lot of um, life lessons that kind of hit you in the face without you even realizing it, especially when you're working with a lot of morbidity and mortality. And I think definitely it's impossible for you to walk away from it without it leaving a mark on you. But yeah, we just hope that those marks are changes for the better and not for the worse.
Yeah.
I have seen a lot of doctors who haven't been able to deal with the stress, and they go into things like substance abuse, severe depression, anxiety, stuff like that. But we just hope that the just as much as you touch your patients' lives, your patients also end up touching your life, and hopefully, we become better people for it. But
Yeah,
yeah,
hopefully by touching you don't give, VRSA or something like that.
yeah, yeah. That's another problem in your line of work.
Yeah.
Um, but so there are, of course, some doctors who swear by making their profession their personality. कि मैं critical care physician हूँ और कुछ भी नहीं. And it defines them. But I feel like the newer generation feels like there needs to be more work-life balance. So how do you feel? You work in a very demanding field. Do you feel that in order for you to be a good physician, you need to dedicate your entire life to it, or do you feel like you can enjoy work-life balance and still be on top of your game at work?
I don't really know if I'm a good physician yet or not. I mean, I'm trying to be. So I can't really tell you that answer really honestly. But in my perspective, I think work-life balance is all I really, you know, thrive for. Because if not, then I would have burned out a lot sooner than I might or might not, do. So yeah, I really want to have that work-life balance. I take offs. I utilize my offs. I go on vacations. I sort of go on long walks. I listen to music, listen to podcasts. Just chill sometimes. Sometimes I don't know what was that Italian word, dolce far niente or something like that. The art of doing nothing or something like that. I enjoyed that as well. So, yeah, I mean, I want to, you know, sort of feel the entire spectrum, and that is how I believe our life becomes more worth living. Although, you know, if you are that kind of a person who has that altruistic tendencies where sort of working for other people gives you that kind of pleasure, a little bit is there in all of us, I guess. But to really dedicate yourself to your profession and to others and not care about yourself, uh, it it might not be the same for you. But I am really not that person. That I do care for my patients, but I do care for myself as well, and I want to enjoy my life as well. I mean, I have just got just one chance at it, and I'm going to sort of try to live to the fullest. So yeah.
Yeah, I think it's difficult to pour from an empty cup. I think you need to
Yeah.
be able to live your
True.
life to the fullest, so that you can be of efficient and effective service to your patients. And I feel like if you come to work feeling down and depressed and drained, I don't think you will really be able to provide the kind of care that your patients deserve. But yeah, maybe we are just not the kind of people who understand that lifelong dedication. Maybe we're just, superficial idiots who want to enjoy a little bit of life. But anyway, so you've been doing shift-based work for a long time, and something that has
Sucks.
boggled boggled my mind as
Yeah.
someone who works 8 to 4 majority of the time. But shift-based work is difficult. But have you felt that it impacts your ability to have a healthy social life or family life, or is that just something that you've gotten used to over the course of the years?
Your body adapts, but the people around you don't really, you know. So yeah, I mean, your social life suffers. I and also, again, the data is out there that shift workers die early, and they have lot more depression, worse sleep, you know, more uh, lifestyle diseases, heart diseases, and all those things. So shift work sucks, but somebody has to do it. And I've accepted the fact that I might have to continue doing that for at least a few more years, uh, mm, if I'm lucky. So yeah, but obviously your social life suffers, your quality of time you spend with your family suffer. I have a few friends I have sort of planned to meet since a few months, but I haven't gotten around to doing that. So your friendships suffer, and a lot more. People around you suffer a lot more than sometimes you do. So uh, so it's very important to have a supporting spouse or a supporting family, and some supportive friends. They will understand and they will realize that it's the nature of your work, and they will continue to support you and continue to sort of make time for you and prioritize you, if at all. uh, if not, some friendships fade away, some relationships fade away. So yeah, I guess that happens.
Yeah, I guess that's part and parcel of being the being in the kind of field that we're in. But yeah, I think some of us are really lucky enough to have supporting friends and supporting families who understand the demands of the field that we have chosen. Um, but yeah, I mean, I'm glad that you have some friends who have decided to keep you around. So the other question, or like this is a little bit of a myth. I don't know if it's a myth, but it's up to you to decipher that for us. Is that critical care workers have this need to chase the adrenaline that they have at work outside of work, and so a lot of them take up hobbies like skydiving or biking to work or something like that. But is that something that you have found to be true, or do you have any crazy hobbies?
No, no, there is enough dopamine or enough adrenaline that I sort of have in my shifts. So I just want to, and himmat kahan hai yaar? I mean, there is no energy left at the end of the shift. My shifts are 10 hours in the morning and 14, 15 hours in the night. So when I come back, I'm just drained. I just want to lie down and do nothing. And on my off days, I just want to go on a slow walk and uh, you know have some you know quality time with my family, and that's about it. I The only adrenaline I get outside work is from video games, so that's about it. Yeah, I my I have met a few people who are really into health and fitness, and I'm not. I'm gaining a lot of weight, so although it's very nice and it's good for you, but some people don't enjoy it as much. You should work out a little bit. That I do, but some people are really into it. Their main motive in their life is to sort of go on these treks and run and jog and go on these hikes and trails and all those things. I haven't met a lot of people who are regularly into those junky kind of thing where they skydive and scuba dive and all those things. Once in a while, yes, but not like a regular thing.
Not really.
So I don't know if it really holds true. Maybe to certain extent, but not really according to me.
Mm. So what video games do you enjoy, Manish? I need
I,
to know.
I
I'm really
have a PS5, and uh, I mean, uh, the the latest game I've played was Miles Morales and GTA 5,
oh yeah.
because I don't have a lot of time, but I revisit a lot of games again and again. So Last of Us was the last game I finished a few days ago, again after like third time or something like that. And Last of Us Part 2, I'm probably going to start again in a few days, I guess. So yeah, I like story based role play games and all those things. So,
That's awesome. That's awesome. So the last thing that I wanted to talk to you about was your journey into content creation. So you had mentioned that you really enjoy teaching, and you have really put together your passion for teaching and also some very impressive editing, I might add,
Yes.
into being able to teach people complicated things like ECGs. And I've been wanting to do that for a long time, but I just haven't found the right way to go about it. And you've done it in a very easy to understand way. So what made you first of all get into content creation, and second of all, where do you think it's going to take you?
Being a part of the emergency medicine thing, I was sort of introduced to FOAM, or free open access to medical education, really early. So I'm a big proponent of FOAM. So, and the thing is, doctors are usually laggard. So there was this guy, Dr. Everett Rogers. He gave this whole philosophy called diffusion of innovations, where he sort of told that how uh, new innovations are introduced in a society. So the guys who adopt something, some new technology, the earliest are the innovators. The first are the innovators, and then the early adopters, and then the late adopters, and then the rest of them are the laggards. So most of the doctors are laggards. We sort of don't we run away from technology. We don't want to use too much of our head. We are just comfortable being where we are, and doing the things we are, and we don't want to adapt to the changing times. But we should. Why shouldn't we? And if you want to teach with a board and a pencil, and if you can make it easy, well, good for you. But if I have the technology at hand, or if I have the skills at hand where I can sort of visually make something more appealing and more easy, why I'm going to do that. So that was my thought behind starting the channel. And obviously, I'm not going to lie, everybody has those ulterior motives. Everybody likes that hit of dopamine and all that, by seeing those likes. And you're spending half of your day, or lot of your time on social media anyways. Why shouldn't you create? You should create. So that was my idea behind starting the channel. I don't know where I will go. I'm hoping good things, but you never know. And like I said, the fleeting nature of life, and your plans might or might not work. I accept whatever comes my way. I might get a little disappointment if it doesn't work, little disappointed if it doesn't work, but yeah, well, I'm going to accept it. So it doesn't really matter. I'm going to continue doing it till I am enjoying it, and then let's see what happens.
Yeah, well, whatever happens, I'll always be supporting because I love the videos, and I hope you
Thanks.
keep it going. Um, but yeah, so that brings me to the end of my questions. Did you have any other comments or anything else that you wanted to say before we close up?
No, I mean, I would have probably switched the roles and would have asked you questions. I don't know if you want to do that in your podcast and all that. So, you've been working in critical care, right? So you have
Y-
been,
yeah,
yeah,
I am now working in critical care. I manage an ICU here in Chennai.
yeah. So, what are your thoughts on what we talked about critical care?
Oh, so I only recently passed out of MD medicine. So when I was doing my MD medicine, it was very difficult for you to really appreciate the impact of the decisions that you make when you are under the supervision of your unit and your team, and you have so much backup in that scenario. Now, when I'm here practicing on my own and I have to manage the entire ICU on my own, every decision weighs on you a lot heavier than it used to. Even dumb stuff which you didn't really think a lot about before, like giving insulin for a patient with DKA, which is a very straightforward thing. It's a very textbook thing, but you still
There are
think about
side.
it. Yeah, so I mean that's the most jarring thing that has been going on. That's the most difficult thing for me right now. But it's getting better, like you said. The more patients you see, you get better at talking to patients, talking to relatives. The other thing is gaining patients' trust. That was something that I really took for granted when I was a resident, and I
I'm
I
taking
have
that for
found.
granted right now.
Yeah, I feel like I found that now that I'm practicing on my own, you have to really put in a lot of effort to gain their trust, especially when the treatment doesn't go the way that you promised them that it would. Those are the times when it really gets put to the test. But yeah, baby steps.
Yeah. Again, like I said, it humbles you, right? I mean,
Yeah, oh my
uh,
God, definitely
working
humbles you.
alone, managing everything, and then realizing that again the things are not going as you planned, sort of humbles you.
Yeah, no, I completely understand when you said you just want to come home and crash. Like
Yeah.
I come home at like 5:30, and I need to just close my eyes and like lie down for like 20 minutes. Otherwise, the rest of my evening is just gone. I'll just be zombieing through the day. So I get it. I
Yeah.
get it too. Yeah, it's crazy.
Yeah, I mean, on my for my morning shifts, you know, I have to reach hospital by 8:30, so I wake up by 7ish, and do the daily ritual. Sometimes take my dog out on a walk, and by the time I'm back at home, it's like around 8ish. So 12, 13 hours are gone, and I'm like standing on my feet for most of the day. So you just want to lie down, have a scoop of ice cream, and
Yeah.
watch something on the television. Uh, I should cut down on the ice cream.
No, it's okay. Little pieces of happiness is what keep you going.
Yeah, I guess.
Don't take that away. Yeah. Okay. Yeah, this was awesome, Manish. Thank you so much for taking time out
Great talking to you.
and yeah, coming and talking. So